100 rupees injection, 1000 in the bill. Now this game will not be played in the hospital, strict preparation of the government. Hello friends, you think you go to the hospital to get a simple injection, the actual price of which is only 100 rupees. But when the bill comes in your hand, it shows the same injection of 1000 rupees. Your eyes are bursting. Aap asks, "Ye kaise?" The answer is, the system is like that. Are we really so helpless that there is no account of the cost of treatment? Will the hospital continue to charge whatever it wants and we will continue to suffer in silence? It will not happen now. Now this arbitrariness will be reined in because the government has decided to end the loot of treatment. Every person in the country reaches the threshold of a hospital at one time or another, sometimes for his own treatment, sometimes for his own treatment. But the biggest concern after going there is the bill. A test, a scan, a little medicine, and empty pockets. People have started to live more in fear than the treatment that the hospital expenses might sink them into debt. This is the reason why the central government has now prepared to take a big step. Today we will discuss this topic in depth. But before that, if you are new to our channel, please don't forget to subscribe to the channel so that you will be the first to get our new video updates. So let's start today's discussion without any delay. Let us tell you that the government is coming soon with a standard hospital bill form for the entire country. Under this format, every hospital, nursing home and diagnostic center will have to give every detail of their patients' bills. How much money is taken for which service, how much is the drug, what is the actual rate of the test, everything will be clearly written in the bill. That is, now the patient will get not only the treatment, but also the truth of the bill. This decision did not come suddenly. In the past years, there were continuous complaints that private hospitals are looting in the name of treatment. Especially during the corona period, this loot had reached its peak. Thousands were recovered in the name of people's oxygen cylinders, lakhs in the name of a bed and unaccounted amount in the name of PPE kits. Since then, the government and even the Supreme Court started taking this matter seriously. According to the report of New Indian Express, Bureau of Indian Standards, BIS, has been working on improving this billing system since last year. And now this proposal is very close to final approval. As soon as this approval is given, a new era will begin in the health services of the country where there will be transparency, where justice will be given to patients, and where treatment will be considered a service, not a business. This standard format of BIS will not only make billing easier, but also make treatment affordable and accessible. So far, every hospital's bill form is different. Some write charges in an arbitrary manner. Some confuse the patient with vague language. Many times patients do not even know what they have paid for. With this new system, this confusion will be completely eliminated. Not only government officials, but also healthcare industry experts, patient advocacy groups, and other stakeholders have been involved in the preparation of this draft. After everyone's opinion and advice, this format has been prepared so that it is not only useful for doctors and hospitals, but also fully understandable for patients. According to the draft, now hospitals will have to give details of every service, every drug, every facility, how many units were used, what was the rate, whether they got discounts or not, what were the alternative services, everything. It will not be just a bill, but a document that will give the patient the right to demand an accurate account of his pocket. A senior official of the Ministry of Health said that now for the hospitals, the adoption of this standardized billing system will be mandatory. No hospital will escape this. He clearly said, "Our goal is that every health service center in the country should follow the same rules." This will prevent billing irregularities and provide relief to the common man. This step is also necessary because last year the Supreme Court reprimanded the central government. The court said that the government is not able to decide what should be the rate of treatment in private hospitals. If a hospital asks for 50,000 rupees for an operation, then someone does the same operation for 5 lakh rupees. There was no answer as to what is the basis of this difference. Now the government is working fast, taking cognizance of this rebuke. The new billing system will not only clean up the bills, but also create a culture of transparency in the entire healthcare system. People will have the right to know how their money is being used. Is this the real price of the drug? Was the test really necessary? Is a room worth so much money? Think, when you get the details of everything, you will be able to make better decisions. You will be able to raise questions if necessary. And this is the greatest strength of democracy, accountability. Now the hospital will also answer how much money was taken for what. This initiative will also bring a big change in the field of health insurance in the coming time. Today, when you fill the form for a medical claim, the bill is unclear. Insurance companies reject the claim. But when the bill will be standard, there will be no excuse for delaying even the insurance companies. The patient will get his right. Apart from this, the government will also ensure that this format is not limited to paper only. Every hospital has to prepare software according to this format, train the staff, and explain the patients in the right way. A necessary monitoring system will also be created for this. This initiative will not only provide relief to the patients, but honest doctors and hospitals will also benefit. Hospitals which used to work properly till now, but their image was bad because of big corporate hospitals, now they will get a level playing field. In a way, this arrangement will also give a new direction to the healthcare industry. The government's intention is clear: treatment is a service, not a business. And this step can prove to be a milestone for bringing this idea to the ground. Going forward, it is also possible that through a website or mobile app, patients can check their own bill, analyze it, and complain about any error directly to the relevant department. The government will also make people aware about this plan. Village, city people will be told that now the treatment bill is their right. And if any hospital gives them wrong or opaque bill, then action can be taken against it. For this, helpline number, complaint portal and local health office will also be active. This initiative can prove to be a boon for every section of the society, especially for the poor and middle class, who sink into debt after every treatment. Now they will also get the confidence that they will not be victims of loot. They will also be able to go to the hospital with confidence, because now the government is standing with them. As soon as this draft of bill is passed and the government implements it across the country, then a big revolution can be seen in the health sector in the near future. It's not just a billing system, it's an idea where patients can demand justice, not just treatment. We hope that this provision will be implemented soon and implemented with full sincerity. Because if it is implemented correctly, it will bring relief in the lives of crores of people. Healthcare will become a service again, and the face of healthcare in India will change.
If our video has taught you something new, do not forget to like and share this video so that this information can reach others as well. Your likes and shares are a source of inspiration for us. If you have any questions or suggestions, please let us know in the comments. It will be our honor to answer your questions and listen to suggestions. And yes, if you like our content, subscribe to the channel and press the bell icon so that you stay connected with every new story. Thank you. GRT Business YouTube channel sources: news from various news agencies, opinion polls and other public sources. We try to ensure that every report and summary is accurate and verified, but we are not responsible for any dispute or error. Our aim is only to provide you with accurate information.